What makes pediatric acute lymphoblastic leukemia so treatable? Imagine a disease that, thanks to decades of research and medical advances, is now highly curable in children. That's what makes pediatric acute lymphoblastic leukemia, or ALL, so remarkable. Over 95% of children diagnosed with this type of leukemia go into remission with modern treatments, and more than 90% survive long-term. This success is not by chance but the result of many factors working together. First, pediatric ALL is very sensitive to chemotherapy. The leukemia cells in children grow quickly, which makes them more vulnerable to drugs that target fast-dividing cells. Doctors carefully design chemotherapy plans to attack these cells at different stages of their growth cycle. This approach increases the chance of destroying all the leukemia cells while reducing the risk of resistant cells surviving. Second, treatment is personalized. Doctors look at each child's specific risk factors, such as age, white blood cell count, and genetic features of the leukemia. Based on this information, they classify children into risk groups. Higher-risk children receive more intensive therapy, while lower-risk children can avoid unnecessary side effects. This tailored approach helps improve outcomes and reduces harm. Third, the treatment process involves multiple phases. It starts with induction therapy to bring the leukemia into remission. Then, consolidation and delayed intensification are used to eliminate any remaining cancer cells. Maintenance therapy can last up to 2 years to prevent relapse. During this entire process, a combination of drugs like methotrexate, asparaginase, vincristine, and steroids work together to fight the disease from different angles. Fourth, advances in supportive care have played a big role. Better management of infections, bleeding, and other complications helps children tolerate intensive treatments more safely. Additionally, intrathecal chemotherapy, which is delivered directly into the spinal fluid, helps prevent leukemia from spreading to the brain and spinal cord, common sites of relapse. Fifth, new therapies like immunotherapy have made a difference. Drugs such as blinatumomab activate the immune system to target leukemia cells. These treatments are especially helpful for children with high-risk genetic features that once predicted poorer outcomes. They can improve survival chances even in difficult cases. Finally, ongoing research and clinical trials continue to refine how we treat pediatric ALL. Monitoring minimal residual disease, or tiny traces of leukemia cells, allows doctors to adjust therapy in real time. This precision helps ensure children get enough treatment to cure the disease without exposing them to unnecessary side effects. From the perspective of leukemia itself, these advances make it harder for the disease to survive. Modern medicine attacks leukemia from many angles, making it increasingly difficult for the cancer to persist. While leukemia can adapt, the current treatment strategies are so effective that most children with ALL are cured. Always remember, if you or someone you know is facing this diagnosis, consulting healthcare professionals is essential for personalized care and the best possible outcome.